Why does Progressive work hard for truckers? Because truckers unite the world. They unite kids with their first drum sets and parents with earplugs. But truckers can't do this if they're not on the road. That's why Progressive has over 360 heavy truck employees to help truckers stay on time and on track. Quote truck insurance today in as little as 8 minutes at progressivecommercial.com. Progressive Casualty Insurance Company and Affiliates.
Every day as a small business owner feels like solving a puzzle. One moment you're cruising along, and the next, there's a shipping snag that has you scrambling. But here's a surprise you will like. With Progressive, small business owners save 13% on their commercial auto insurance when they pay in full. So go ahead, surprise yourself. Get a quote in as little as 8 minutes at progressivecommercial.com. Progressive Casualty Insurance Company and Affiliates. Discounts not available in all states or situations.
Insurance isn't one size fits all. That's why customers have enjoyed Progressive's Name Your Price tool for years now. With the Name Your Price tool, you tell them what you want to pay, and they'll show you options that fit your budget. So whether you're picking out your first policy or just looking for something that works better for you and your family, they make it easy to see your options. Visit Progressive.com. Find a rate that works for you with the Name Your Price tool. Progressive Casualty Insurance Company and Affiliates. Price and coverage match limited by state law.
Welcome to a very special episode of the podcast. I'm Kellie Raspberry Evans, and I've got a couple of very special guests joining me today. You know, February is Heart Health Month. We're putting the focus on heart health. After my heart scare last year, suddenly I started paying attention because until something affects you, you're like, oh, that's somebody else's problem, right? But the truth is that more women die from cardiovascular disease than all cancers combined, which is actually a very scary thought, right? So today, we're actually going to talk about a certain area of heart health because a lot of times women experience, we experience things that men don't often experience in their lives. We go through very different transitions like pregnancy. Men don't experience that, or menopause, even though some people say there's a thing called menopause. I don't know about that, but because of those hormonal changes in our bodies, we face very different heart concerns than some men do. And to talk about what can happen to a woman's heart health during pregnancy, we not only have a woman who experienced that during her pregnancy, we also have an OBGYN, Dr. Omar Cabrera, who's joining us, who can give us, from the medical standpoint, from his perspective, as well as a woman who's actually been through it. So first, we're going to welcome Dr. Cabrera to the podcast. Welcome, Dr. Cabrera.
Hi, thank you very much, Kellie, for having me.
Thank you. And you are an OBGYN, and you are with Texas Health Harris Methodist Hospital in Stevensville, as well as with Texas Health Physicians Group. How long have you been an OBGYN?
I've been, out of practice, out of residency since 2016.
All right.
So now for 8 years.
How many babies? Have you even kept count of how many babies you've brought into this world?
The only time that we had to actually track them was in residency. And then after that, I don't know. I stopped counting.
Yeah, but a lot. And you've seen everything, I'm sure, come through your office. But for you here today, I know you're not a cardiologist. You are an OBGYN, but based on the patients who've come through your practice, you know how heart health really affects women, especially during this season of life. Can you explain why heart problems are pretty common during pregnancy?
If you just even look at how many pregnancies there's about 4 million pregnancies in the U.S. per year. And heart conditions can occur in 1% to 4% of those. So that's quite a bit of pregnancies that you're dealing with that are going to be high risk just because of cardiovascular disease. And the troubling part about that is that you can kind of classify heart disease into two components: the ones that you're born with, what you call congenital, and the other ones which are acquired. The problem is that if you look in the US, the acquired ones are staying pretty constant. And then the ones that people are born with, the congenital ones, those are actually on the rise.
We're hearing more and more about people who were born with these, congenital heart defects, and there's like no symptoms, or either symptoms that are overlooked until we have this catastrophic episode. Is there something about, like, if a woman is born with a congenital heart defect that hasn't, displayed itself, something about pregnancy that brings that to the forefront?
So pregnancy creates so many changes in your body, anything from you having more blood volume, you're having a greater output of that blood volume, your blood pressure dropping, your heart rate increasing. So the pregnancy itself can be seen as a stress test, like a cardiac stress test for your body of saying, can you handle these increased demands on your body? So what your body probably could have handled before, well, all of a sudden with this added stress, it may not be able to handle. And so that might be why the patient starts to have either the symptoms and or potentially the complications that can happen because of that heart disease.
Yeah. And I know like my girlfriend, she developed preeclampsia. It was kind of like it was a very emergency situation. And then you have some women who've experienced gestational diabetes and things like that. Is it possible that you can have a perfectly healthy heart until you're pregnant, and then after the pregnancy is over, you go back to normal heart health, or is that permanently affected beyond the pregnancy? Like, gestational diabetes, sometimes that's just during the duration of the pregnancy, but does the heart issues linger?
Absolutely. So there is a large concern in that it does increase a woman's risk. So if you have a condition like preeclampsia, if you end up having in various forms, it can be, sometimes you might hear the term gestational hypertension, preeclampsia, severe preeclampsia, well, and then separately the condition of gestational diabetes.
Mm-hmm.
So with a condition like preeclampsia, it's supposed to resolve within 12 weeks. If it doesn't resolve, then we then constitute that there was pre-existing chronic hypertension that just was not diagnosed, mm-hmm. or that it developed into a chronic hypertension, just meaning that now the patient has this condition as a permanent situation. Same thing with the gestational diabetes. Gestational diabetes, though it occurred in pregnancy, if it doesn't then develop immediately, it definitely can increase the risk in a woman's life for type 2 diabetes later on in life. And the problem is that those two things, high blood pressure and diabetes, both of them are considered risk factors for heart disease. So if we were talking about the congenital ones, that's a separate matter. But if we're talking about acquired disease, so if we consider things like a heart attack, a stroke, if you consider things like disease, I know that later on the condition is going to be about talking about the arteries, about the mm-hmm. artery dissection. So conditions like artery disease that can end up leading to a heart attack or leading to a stroke. Those situations, well, diabetes and high blood pressure are huge risk factors that can lead to those complications in a woman's life, whether in pregnancy or outside of pregnancy.
Mm-hmm. Now, if a woman knows before she gets pregnant, like it's going to be a planned pregnancy, but I know I'm already dealing with high blood pressure, or I have a history of heart disease in my family, is there a way that she should approach her pregnancy different than another woman of normal blood pressure would approach it?
Absolutely. I think it would be important for that patient to go to her primary care provider or have what we call a preconception counseling visit with an OBGYN, which basically means they go into the office and say, am I healthy enough to get pregnant? Am I on the right medications to be able to be on while I'm pregnant? So the first thing is then for that provider to then help identify what is the blood pressure controlled? Is the blood pressure so uncontrolled that it would be deemed very unsafe to get pregnant because the pregnancy itself can create further issues? For one thing, it increases the risk of a pregnancy loss, mm-hmm. even early on in pregnancy. And then to evaluate the medications, because there are certain medications that are not recommended, not permitted in pregnancy because they can affect a unborn baby.
Yeah. And now we have so many, I know in order to have the baby that your heart desires, sometimes if it's about your heart health, there are other alternatives, through surrogacy and other methods to have the baby you want, that, if there is a situation that your own life is at risk if you go to pregnancy, that's something that can be determined before you become pregnant.
One part of the visit also would be if it's not dealing with just hypertension. So hypertension can lead to, issues of another issue that could be is like you could have had it long enough that it creates a heart that then goes through heart failure. So there would certainly be conditions that would be then contraindicated. So when you would go into that provider's office, a due diligence on our end would be to identify how much of a risk is this patient going into a pregnancy. And we categorize it into 4 different categories. It would be low risk, and then level 2 and 3 would be moderate risk, and then level 4 would be high risk. And they basically call it the WHO or the WHO classification. And there's a modified version of it, but basically classifying should somebody even consider a pregnancy. Level 4 would be a strong contraindication. Don't get pregnant, avoid it if you can. And so depending on the level would determine how closely you're going to end up needing to be followed and by how many different specialists would be a part of the team to be followed with.
Right. Now, how early in the process, I mean, when you're planning your life, your adulthood, your parenthood, and things like that, you have to identify these patients who would hopefully have preventable conditions. How do you go about identifying those women?
Sometimes that's very difficult, especially if somebody doesn't have any symptoms. So the best way is to have a patient just come into the office, and it's through a conversation of saying, well, tell me, do you have symptoms where you can't sleep at night without having to place several pillows? Tell me, do you get really tired and labored with just minimal activity? Do you feel heart palpitations? Those visits, you think oh no, I can skip my primary care visit. Well, for some, it ends up being a serious matter where those early signs, maybe it was the palpitation, we heard extra heart sounds that shouldn't be there. So those things are what should prompt that early identification to, more than anything, try to prevent those bad complications.
And I have going back to my friend that had the preeclampsia. She loves to tell that story. By the way, we've heard it over every time it comes to her daughter's birthday. She's like, I almost died giving birth to you. She reminds her of that every year. But what is exactly preeclampsia? We keep hearing it, but I feel kind of stupid asking exactly what is preeclampsia, and is that tied into heart health, and what are the symptoms? Is there any way to prevent it, or you just know it's coming and we got to deal with it?
Preeclampsia, I guess you would consider it is definitely a hypertension condition or a high blood pressure condition. In its classic form, preeclampsia is high blood pressure together with protein in your urine that's spilling out of your urine. So how it's thought to be caused, there's some theories in it. One of the theories is that the blood vessels that feed into the placenta at around 12 or 13 weeks of pregnancy, they're thought to not dilate as they should. So they remain more constricted. So, but you don't see signs of that until later on, usually not until 30-something weeks.
Yeah,
and
she was far along in the pregnancy when it was discovered, and it was scary.
Classically, a lot of times we see patients that are, 35 or over 35, 36, 37, sometimes 40 weeks. And then know that sometimes it doesn't present until after you've delivered. You've gone home, you think everything's fine, and a week later you have blood pressure issues, and then it turns out that it's preeclampsia.
I didn't know you could have it after you gave birth.
You can. It's not common past about 2 weeks. But for sure, up to a week, we still see it happen every once in a while, for sure.
Wow, I had no idea about that. And I was also looking at some of these notes I had, and when it comes to breastfeeding, it actually says that women who choose to breastfeed, actually, there are more than just benefits for the baby, that it actually can help reduce your own heart disease risk. How does that work?
So I can conjecture how it may work. I think that it's probably breastfeeding. Maybe it's a mix of decreasing weight, because we know that it burns like 500 calories a day by exclusive breastfeeding. And then weight's an independent risk factor for decreasing your risk of high blood pressure and diabetes. So maybe it's through those mechanisms. I do know that if you breastfeed, it's like over a lifetime, like cumulative breastfeeding, 6 to 12 months worth of breastfeeding, it decreases your heart health risk by 10%. So it is a significant decrease for a women's health, for sure.
I think it's also important. I know it's been a long time since I was pregnant. My daughter's 17 now. But I would think when you go for your regular gynecological appointments throughout the pregnancy, that there's a lot of things that a doctor would not test for or look into unless you verbalize that to your doctor. So as a pregnant woman, if you're having something that's just maybe a little bit off, but also you don't want to be the worry wart that brings everything to the doctor. It's like, what should that conversation be like with your doctor if you're experiencing something? Because they normally wouldn't test for heart problems, right? Unless you bring something up verbally.
That's correct, especially if someone's young. I think that, if somebody were to say, because a new patient will generally fill out a review of systems form, and sometimes you see some patients put nothing on it, and sometimes you see almost single thing on there checked off. And so I think anything that's persistent or has some repetitiveness where it wasn't like, oh, a year ago my head hurt or something like that. But it's, there's a frequency of, I get short of breath when I do these activities. There's a frequency of, I have some chest pain with these activities. My legs get swollen, or I feel my heart racing. I get really sweaty, clammy, that kind of stuff. So I think having some sense that it wasn't a fluke. It didn't just happen once, but you've noticed, gosh, this has happened a few times. Or I really felt really weird. And then now classically individuals wear an iPhone watch or some sort of watch, right? And it tells them their heart rate, and it tells them, hey, wow, your heart rate's really accelerated. So I think that that's actually been a big benefit for identification of elevated heart rate in different conditions that have prompted them to then go to their doctor and say, can you please, evaluate this? I don't think there's some real data here saying that my heart was racing at 150 beats per minute and I was not doing any kind of physical activity.
So if you've always wanted an Apple Watch, ladies, when you get pregnant, tell your husband, it's for my own health. I have to get an Apple Watch now if he hasn't let you get one. Because that is interesting that you can have all the data right there. Because what always happens, you experience something when you're home and you get to the doctor's office and they're like, well, everything's fine when you get there. But then you have the data that you can go back. That's really great. I like that. All right. Well, it's, just shocking to learn, that heart disease is the number one killer of, women, but, that it's also the number one killer of new moms. And what do if we could just leave women today who maybe are thinking about becoming pregnant, who are pregnant, who maybe just had a baby, what's the number one message we could leave with these women when it comes to their heart health?
I would say that importantly, if you're not yet pregnant, it would be in your best interest to be evaluated to see, are there concerns, just at a well woman exam, are there concerns that need to be brought up or hopefully will be identified in your health that would make you consider, is this the right time to get pregnant? Or do I need to make some changes in order to be in a healthier situation to get pregnant? And if you are currently pregnant, try to be seen as early as you can, because then that reduces the risk of complications for your own health and then hopefully for your own baby's health, because the hope is that you don't end up with a worsened heart condition or that you end up impacting your baby's health, which may lead to needing unwanted delivery early, where you end up losing a baby, or you end up having a baby that doesn't grow well. So all the aim is early identification, and it gives us, if a patient gives us the opportunity to come in earlier, we can be a part of that process.
Great. Well, Dr. Cabrera, thank you for all that information. I learned some new things today talking to you. Are you accepting new patients, by the way, in case someone's looking for an OBGYN?
I'm always accepting new patients.
Oh, good. Well, if Dr. Omar Cabrera sounds like the gynecologist for you, we'll get you in touch with Dr. Cabrera. But thank you for all that information. I think hopefully some women hear it today and it will make a true difference in them taking control of their own heart health, because women we have to pay attention to anything we notice is a little bit different, and that little voice inside your head that's telling you something's not right, you need to get it checked out, right?
Can I give you a couple of websites?
Absolutely, please. And I'll write them down too.
One of them is through the CDC, and it's cdc.gov and then /hear her. So it's actually women that have been pregnant that have had complications, and you can hear some of their videos, and it also gives you good advice as to when you should be worried and what you should do during a pregnancy.
Oh, okay. cdc.gov/hear, HEAR, her, hear her.
Correct.
Okay.
And then the other one, of course, since I work for TexasHealth.org, has good resources as well. If you search under the bar women and heart health or pregnancy and heart health, and it'll have good resources as well for what to be on the lookout for.
Probably put those in the show notes too for everyone. We'll put those in the show notes in case you're driving and don't have a chance to write those down. Dr. Cabrera, thank you so much for your time today. I know you've got to get back to work and patients to see, but thank you for taking time out of your day to share this with us.
Thank you very much.
Thank you.
Have a great day.
You too. Bye-bye. Well, I learned a lot from Dr. Cabrera, but I think it's always important. I mean, he's a doctor who deals with women, but it's also important to talk to a woman who's actually lived through this. And this is actually someone I met back in October when we were shooting a campaign for the Go Red For Women campaign for the American Heart Association. And her name is Taelur Littlejohn. Welcome, Taelur.
Hello. Thank you for having me today.
Oh, it's so good to see you again. It's really good to see you again because when you walked in, you told me you're actually doing even better now than you were when I saw you, 4 or 5 months ago?
Yes, definitely I am. My heart is getting stronger, so we're definitely making some major progress.
Now, Taelur is a woman who has a very rare heart condition, but you did not know this was a thing until after you gave birth, right?
Yes, that's
So
correct.
real quickly, why don't you just, I don't know if you can tell it quickly. You take your time, as much time as you need. Tell everybody what happened to you.
Pretty much, I had a very healthy, normal pregnancy. Towards the end, even the labor was pretty much normal, but shortly after, that's when everything took some turns. I got released from the hospital. I ended up going home, and literally like that same day, I started experiencing some major chest pain that I knew was something I had never felt before that was very intense. So my then 10-year-old ended up calling 911. They got there, and they knew that something wasn't right. I was immediately getting rushed to the hospital, and come to find out, I was actually having a full-blown heart attack.
And you had never had any symptoms leading up to that moment?
No, none. No, the only symptom I can say was pretty much the chest pain. Like, it was so intense. Like, I literally felt like an elephant or something, just so like bricks were just like pressing down on me, and I couldn't like shake the feeling at all.
Yeah, and ultimately you were diagnosed with a rare, serious heart condition called, please tell me if I'm wrong, spontaneous coronary artery dissection.
Yes.
SCAD for short.
Mm-hmm. That is correct.
What does that mean? I'm sure you probably, having gone through this, you feel like you've got a medical degree at this point,
oh, yeah,
right?
definitely.
By default.
Definitely.
What happened?
So, like you said, it's very rare, but it is something that happens primarily in pregnant women, and they also say it can happen to anyone, but most of the cases have been in women that are either pregnant or right in the postpartum phase. So mine happened in the postpartum, like literally 2 days after I delivered. Mm-hmm. So spontaneous coronary artery dissection is pretty much when your artery just decides to dissect from everyone else and do its own thing. And that's pretty much what happened to me. Like, literally, I went to one hospital, and then I was transferred to a actual heart hospital in Dallas, but had I not got there in enough time, I literally would not be here today. They said that my artery was like closed at literally 98%. So,
wow.
Yeah, it was very crazy. So that's what made me have to go and get the triple bypass, because they had to, redirect and get me some oxygen and blood flow to start going regularly.
That's crazy. And this didn't happen until you went home. You had your brand new baby. Thank God your 10-year-old was there to call 911. Mm-hmm. And so you went immediately to the hospital. How long were you separated from your brand new baby? How long were you hospitalized?
It was about 2 months for sure. It was about 2 months because with the heart attack being so intense, and then with me being like young, they say a lot of heart attacks present different in women versus men. And then also, like, it's a very rare thing. So a lot of doctors and things are not even aware of what SCAD is. So they just were like, it's no way.
It's rare.
Yeah. But they knew something was heart related because of it's something you have called enzymes where you know if your heart is under a lot of stress, and my numbers were like up over 60,000 and it should literally be under 5. So
Well, the scary part is because it is such a rare condition, nobody's looking for that.
right.
So even if you have it, how would they even know? I mean, was there anything that could have been done to prevent what happened to you if you had known you even had it?
From my understanding, the reason it's called spontaneous is because it's literally like
It's just like a ticking time bomb.
Yeah, it just happens. And like you said, a lot of people don't know to look for it because I remember at one point saying, I feel like I'm having a heart attack. And they're like, oh no, you're only 28 years old. There's no
That
way you're
happens all
having.
the time.
There's no way. And I'm like, I don't. And I've never had one, but I just was imagining the feeling I was feeling. Like, is this what it feels like? Because I'm like, something's not right here.
Yeah.
It was not like your normal, chest pain or I don't know. It just was very abnormal for sure.
Yeah, and that's something because you knew something was wrong, but how many women do go to the doctor and they're just told it's stress, you're tired, you need to sleep more, eat better, and get more exercise, pat you on the head and send you on your way. But I think that's one of the reasons why heart disease is the number one killer of women because the symptoms are dismissed. And unless you, as a woman, are an advocate for your own health and keep insisting on seeing another doctor until you get the answer that you're looking for.
Right. I totally
Now, in
agree.
your case, thank God you survived this because I'm quite sure a lot of women don't.
Yeah, there are.
And it wasn't just after 2 months that you just got to go home and went on your merry way. You've had to go through some heart rehabilitation.
Oh yeah, I had to do it actually twice. So this happened because I had my son January 2nd, 2022. So of course all of that beginning of the year was straight hospital. And originally it was a big deal. They didn't even know if they really wanted to release me because my heart was just not functioning at the normal rate at all. Like it was even talk at one point about me possibly needing to get a heart transplant. But I went home on a heart machine, and then, just was taking my medicines, and then we started the cardiac rehab, which I felt like helped a whole lot because, like, I was so and of course we know our heart is like the major organ in our body, but it really dictates everything. Like you just walking and, just everything. I didn't have a lot of energy and stuff, so. Working out and really trying to build my stamina back and everything that it took a while. Like even just kind of like, walking here or whatever, just, but I'm doing way better. Like I'm doing way better than I was for sure.
Your energy seems better. When I met you in October, I mean, your energy seems better today than it did back then. And you said it's because your heart is continuing to get healthier with every beat. So you were saying you had only how much capacity in October, and now it's improved to what?
So in the beginning, so pretty much, of course, if your heart is operating like at 0, then that means you're pretty much dead, right? Yeah. So I was at 5. So a lot of the doctors literally, I'm not gonna say they didn't have hope, but they literally called my mom and was like, we don't know, we don't think she's gonna make it, but. I was on life support all throughout that time, and then they were just trying everything to like get it back. But
you had no idea any of this was going on
because I was out of it for like a whole week. I think they had me under I don't want to say the wrong word, but when it's like an induced coma, just to keep me calm and everything. Because I didn't even know I was getting rushed into the triple bypass surgery. Like I knew
I
was
that's a blessing, right? That you don't even know. Yeah.
But like over and then when it got up to 20 and then we got up to 30 and then, my cardiologist I have now is some new medications that came out that's supposed to like help with heart failure. So we tried that in addition to me, still keeping active because the thing about working out and why it's so important, even if you don't have you've never had this, if you're just in general, I feel like everyone being active helps because your heart is like pumping. And if you're in heart failure, you don't want it to get stuck at that slower rate because then that's what creates more problems. When you're working out, you're forcing your body to like overwork and it gets used to it. So by me doing that is what has helped me get it better because it's like, okay, we're getting back to normal. And then not to mention with me already being young and overall healthy, like they've ran every test on me you could think possible to see like, okay, does she have this? Maybe she has that. Maybe she has this. Like what could have caused this? But it's literally like nothing. I don't have high cholesterol, like nothing. So that's why it's like scary. Like you said, it's the number one silent killer for sure.
Do you ever stop to think why you? Have you learned something through this that you feel like this was a journey that was chosen for you? And, because there has to be some purpose behind this, right?
Yeah, I definitely went through a hard phase. And sometimes I still deal with it a lot because I've always been a person that was like, I still am into myself, but I'm more self-conscious because, for one, I've been cut from chest down in the middle. So I have this big scar, like just all of these scars that is like a constant reminder. But like you said, I went, I was having my times of kind of being depressed and everything, but I just got to a point now where I look at it like, look, I'm still here. I'm able to see my kids and able to raise my children, and just to hear other stories of women that did not make it, that like literally died. And it's just like, it's a blessing to still be here. So instead of saying, why me? I look at it like, well, why not me? I have a voice. I can educate other people. I can try to help bring awareness to this issue and try to help other people. And like you said, look for signs. Even people that are in the medical field that are not aware of it. You'll be surprised of how many doctors and nurses that are like, I never even heard, like, I didn't even know this was possible. Like, what, so I feel like it is something that needs to be looked into, especially during pregnancy, instead of just our normal checks. So like, maybe when you're pregnant, we do need to start getting like, echoes and looking at your heart, or checking, other blood work to just see certain things.
Make it a routine part of the
definitely.
prenatal and natal exams? Is that what it is? It's prenatal. You got to have a natal, right?
Mm-hmm. And what's crazy is, like, I remember towards the end of my pregnancy, the only thing, but my OB, I was just told, oh, well, you're pregnant. I did feel like I was having a lot of heartburn, but we all know, like,
that means your baby's going to have a lot of hair.
Exactly.
That's what we're told.
Exactly. And I remember, like, that was the only thing that I can pretty much think of. But yeah, I definitely feel like I just want to bring more awareness and try to help be like a change in somehow. Or when someone hears my story, if they're feeling like, well, maybe I'm experiencing this, or maybe they know someone that's went through that. Because I remember when it happened to me, I knew no one that had ever had this happen, like, ever. And I've had 2 kids prior, so this is something that was like, how did this even happen? So I was literally on YouTube, Google, Facebook, on every platform you could think of, trying to search and figure this out. And then I saw this girl, she's in Canada, but same situation happened to her. And then I found a page on Facebook, which is like this private group. And like, I don't know, I found my people in there. Like, and it's like everybody's story is literally like crazy. Like the same, like one lady, hers happened when she was like pregnant. So they not only had to do a random C-section and then put her under triple bypass. So it's just like, man, like this is really happening. And it's just crazy that you don't hear about this at all.
Well, because it's so rare. But now you're sharing your story. And I think even if women don't experience what you did necessarily, but if they have something that's going on, because like we said, cardiovascular disease, heart attacks, what's the other word I'm looking for? It's escaping me right now. But this is the number one killer of maternal deaths as well, of women. So it's just important to get that message out. If you sense something is different, something's not right, go to your doctor. If you don't get the answers you're looking for, go to another doctor. I think a lot of times as women, we're afraid of hurting our doctor's feelings. If we just don't take their word for it, and to go get a second opinion is almost like insulting to them. But, our good manners could kill us if we don't do something more proactive. Well, is there anything that you would like the women listening today, and maybe some men too, because there's probably some men listening who have pregnant wives. I don't know how many women listen to this podcast, but I mean men, I should say. But what is the message you'd like to leave everyone with today?
Pretty much, like you said, you're the best advocate for yourself. If you feel like something is not right, if you feel uncomfortable at any point about anything, definitely seek medical attention. Ask those questions. Like you said, if you feel like you're not getting everything from that provider that's helping you, get another opinion from someone, because it literally can happen to anybody. You don't have to have high cholesterol, diabetes, high blood pressure to end up having a heart attack. Like, I literally was 28 years old, no underlying health issues, everything good, and then this still happened. So I just feel like, don't take life for granted.
Right.
Always aim for, trying to be active, eating healthy, just doing a lot of things to just help avoid some things. Although this is not something that was avoidable, but still, like, just don't think that you're counted out from something happening to you, for
Right.
sure.
Just because it never has.
Yeah, but
It's
definitely.
not always somebody else's problem. One day you wake up and it's your problem.
Mm-hmm.
Well, this is American Heart Association Heart Health Month. Go Red for Women is the
Yes,
campaign.
definitely.
And I think the real takeaway here is that losing just one woman to heart disease or stroke is just one too many.
Mm-hmm.
As we've said repeatedly today, that all women need to know that cardiovascular disease is the number one killer of women. So awareness is critical. It's important to know your numbers, the key personal health numbers that help determine your risk for heart disease. That would be your total cholesterol, your blood pressure, blood sugar, and body mass index.
Yes.
I would imagine you get those checked probably every year. That's an annual check you should get. Also, it's important to know your own family's history. Even though you didn't have a family history, some people might have family history, and talk to your doctor about that if there's any history of heart disease or stroke in your family. And just take charge of your own health. Lower your risk of cardiovascular disease with the tools and resources from the Go Red for Women on physical activity, healthy eating, controlling your blood pressure, and managing sleep and stress. And hopefully we hammered the message into everyone's heads today.
I hope so,
Taylor.
too.
Well, Taylor, thank you for sharing your message, and it's so
Thank
good to see
you.
you. And
Thank
I'm
you.
glad
It's good
you're doing
seeing you,
even
too.
better than the last time I saw you. Taelur Littlejohn, and also to Dr. Omar Cabrera for taking his time and talking about heart health before, during, and after pregnancy. Again, for all the websites we've given you today, you can find those in the show notes. And, of course, the website for the American Heart Association is heart.org. It has so many resources there for men and women alike if it comes to taking control of your own heart health. Well, thank you so much, Taylor.
Thank you. Thank you for having me.
Thank you.
This episode is brought to you by Progressive Insurance. Do you ever think about switching insurance companies to see if you could save some cash? Progressive makes it easy to see if you could save when you bundle your home and auto policies. Try it at progressive.com. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary. Not available in all states.
Every day as a small business owner feels like solving a puzzle. One moment you're cruising along, and the next, there's a shipping snag that has you scrambling. But here's a surprise you will like. With Progressive, small business owners save 13% on their commercial auto insurance when they pay in full. So go ahead, surprise yourself. Get a quote in as little as 8 minutes at progressivecommercial.com. Progressive Casualty Insurance Company and Affiliates. Discounts not available in all states or situations.
Why does Progressive work hard for truckers? Because truckers unite the world. They unite kids with their first drum sets and parents with earplugs. But truckers can't do this if they're not on the road. That's why Progressive has over 360 heavy truck employees to help truckers stay on time and on track. Quote truck insurance today in as little as 8 minutes at progressivecommercial.com. Progressive Casualty Insurance Company and Affiliates.
A new school year means a fresh start. For families that are looking for a new path to help their child succeed, K-12 could be the perfect fit. K-12 powered schools offer tuition-free, accredited, online public education for students in kindergarten through 12th grade. They know learning isn't one size fits all and will meet your child where they are. K-12 has been a leader in online education for over 25 years. They provide everything a student needs to feel safe, motivated, and thrive in their learning environment. With flexible education options tailored to each child's needs, interests, and goals for the future. K-12's dedicated teachers are trained in virtual instruction and provide real-time support. Plus, students will belong to a vibrant online community with opportunities for extracurricular activities to help them connect with peers and explore interests, all in a setting that works for your family. See how K-12-powered schools can help unlock your child's full potential. Enroll online today at k12.com/FWD. That's the letter K, the number 12.com/FWD. K12.com/FWD.